The Zucker Hillside Hospital residency can prepare you to be essentially any kind of excellent psychiatrist that you want to be.
It just felt like such a family who was so supportive.
I knew these were my people. This is kind of where I fit in the most.
The reason that you're here is to not just learn, but to learn what your passion is.
I'm John Young. I'm the Vice Chair for Education and the Program Director in the Department of Psychiatry at the Zucker Hillside Hospital. At Zucker Hillside Hospital, we have a residency. It's a total of 52 trainees, 13 per class. We're looking for students who want to become outstanding clinicians, excited about clinical psychiatry. They want to learn how to bring healing and care to folks who are suffering with mental illness.
When I was looking for where to come for residency and where to apply to, I was looking for a place that had an independent campus that was focused fully on behavioral health. It doesn't hurt that Zucker happens to have really world-renowned researchers.
Our vision for Zucker Hillside Hospital has always been to be a really outstanding facility for clinical care, training, and cutting-edge research. And it's our belief that you have to be excellent in all three. We see a very diverse array of patients.
So Zucker Hillside Hospital is situated right on the border between Queens and Long Island.
The surrounding area is really diverse, and that was really important for me.
One day I may come in and I may be working with a successful businesswoman. The next day I may be working with a 15-year-old patient from China. What it means when we have a patient population that's so diverse, it means that when it comes to pathology, you're going to see a great spectrum of pathologies, which also means you get to try out different treatments, see what works, what doesn't work.
Zucker Hillside Hospital is an amazing freestanding psychiatric campus. It has over 240 inpatient beds, different types of subspecialty units ranging from affective disorders to first episode.
You have a geriatric unit, an adolescent unit, a women's unit, a college unit, and during your residency you have the opportunity to rotate through all of the different ones.
You just get to see so many different things all throughout, and also get to work with really, great attendings at all of those places who bring sort of different, unique elements to their teaching.
We also have our medical hospital, which is LIJ, right across the street, where we rotate on CL psychiatry, neurology, and medicine.
And so there's just so many different ways to learn about different populations here, and I think that was one of the big things that drew me here.
When you start off as an intern, first year, you get at least 5 months of inpatient experience.
And then we start continuity clinics, which is an outpatient psychiatric experience very early on in residency as well.
The continuity clinic has been a really important part of my training. You learn how to essentially have a little tiny practice.
We're really invested in having faculty directly observe and give our residents feedback in real time. So that is a real distinguishing feature, I think, in our program. It's all about growth. It's about becoming better. How do I become the best doctor that I can be?
For some people, they come into residency, they know exactly what they want to do. For me, I knew I wanted to be a psychiatrist, but I wasn't so sure in terms of where my career was going to go. And one of the things that I really appreciate about the residency program here is there are so many opportunities. It's like Baskin-Robbins, like 31 flavors of things that you can do.
Whatever you develop an interest in, you'll be able to find a mentor whose interests line up with that.
We're about helping trainees find where the passion of their heart meets the need in the world, and that's what we call calling. And we have a whole set of programs that wrap around that process to help a trainee do exactly that. Advising, our Pathways program, all this elective time early in training.
This program is particularly unique in the way that they are able to customize a curriculum, customize mentorship, and customize even your clinical experiences to ultimately help you sort of get each step of the way and build towards the vision that you have for yourself and your career.
I did things that weren't normally part of our curriculum, but were things that I saw in the community that, hey, I'm interested in this, I want to learn about this. Dr. Young in the residency training program was like, go for it.
The Pathways program is really exciting. It's one of the main reasons I wanted to come to Zucker Hillside Hospital for residency.
So the Pathways to Discovery program is giving us the opportunity as residents to develop a focus of expertise during second, third, and fourth year.
So you have dedicated time to work on a project of your choosing.
I did my pathways related to violence in the psychiatric population. I had the opportunity to train local police officers.
For my Pathways project, I decided to focus on global health, providing mental health care access to people in Ecuador.
Northwell Health has a Center for Global Health. I'm really excited that Psychiatry has created a global mental health initiative, and we are partnering with communities in South India, and Ecuador, and Guyana right now.
I went to Ecuador last year for 4 weeks, and now I'm going to continue working with that same clinic and developing it into my own Pathways project.
And those experiences give us opportunities to provide care there and support, but also deepen our commitment and engagement with communities right here.
The residency program leadership is engaged in promoting their residents in finding their own path and developing new initiatives. One excellent example of this is the RISE program. RISE stands for Fighting Racial Injustice and Supporting Systemic Equity. The commitment that they have shown really inspires me, and I think that's one of the real benefits for any resident who chooses to come to our program.
Another advantage of Zucker Hillside Hospital is that we have faculty who are very interested in supervising trainees interested in research, and they can participate in research ranging from brain imaging to psychosocial treatments and digital technology. We're looking at wearables to help us measure sleep.
You know, how can we use remote monitoring to predict, okay, how's this patient doing? Are they decompensating? Are they getting better? Are they taking their medication? And so when you have research like that, it enables you to try to challenge the status quo and think, okay, how can we use some of these ideas to improve clinical care?
At Zucker Hillside Hospital, we're very committed to the wellness of our residents and wanting to support their development. We offer things like weekly support group for each class.
There is a dedicated 4-year wellness curriculum. The program allows for wellness days.
We also have flexibility at all levels built in to the curriculum, which is key for well-being.
And we actually make our call schedules as a class, and so we're able to pick and choose the dates together that work for each of us.
Every weekend, pretty much, I go on hikes and camping, and everything is within an hour, more or less, away.
Training here at Zucker Hillside Hospital allows me to live very close to the city. I get to enjoy all that New York has to offer.
I live in Williamsburg, which there's a few other residents there.
I live in Queens, but very close to Manhattan because it's really important for me to be able to easily travel back and forth.
I decided to live on campus, subsidized by the hospital, which was a huge perk for me.
I'm a 5 to 10 minute walk from the hospital, so it's great.
The surrounding area, the food is really good, which is what the other thing that I like.
I think this is an incredibly exciting time to be going into psychiatry.
The quality of training here at Zucker Hillside Hospital is impeccable.
If you are a curious, ambitious person, then there will be so many opportunities for you here.
Because I was able to follow my passion and follow my interest in learning, my goals and my aspirations for the kind of clinician I want to be expanded from, okay, I just want to work with these kinds of patients, to I want to work with these communities.
I don't think I would have gotten that kind of experience anywhere else.
Every day I'm inspired by our residents as I mentor them and I hear about the amazing things that they accomplish during residency. It makes for an incredibly stimulating place.
This program really challenges you to not just be a physician, but to find a place in this community, in this world, which is pretty awesome.